And now for something completely different. Shamila didn't actually have a choice. She didn't volunteer for anything. We volunteered. I'm really sorry, I have to rush off after this. I wanted to go back a little bit and give you an idea of the current reorganisation of the health service and how ReSPECT fits into that landscape, and certainly from our perspective in Kent, Surrey, Sussex, because we made a strategic decision that we would try for the implementation on an STP-wide basis, and were that not possible, on a kind of geography within the STP-wide basis. So those are 3 STPs I'll be talking about. Surrey Heartlands, where the ReSPECT implementation has been successful, and that's almost 100% done to Jacqueline Joyce there in the Royal Surrey County, a huge amount of work. Sussex and East Surrey STP, where we're doing an end-of-life care improvement project across all of the arm's length bodies involved in health and social care, of which my organisation, Health Education England, is just one, and Kent Medway STP. Firstly, I wanted to say that ReSPECT for us, we are using it as a press the button on a refresh of education and training around end-of-life care across the entire Kent, Surrey, Sussex, and the end-of-life care pathway for our patients. We felt very strongly that it was important to resource the implementation of ReSPECT, and therefore we effectively deliberately held off until the structures of the STPs had embedded and we could see the shape of the organisations within an STP that we might need to bid for resources for our ReSPECT implementation. And essentially those structures are the LWAB, which is the Local Workforce Action Board. Could I have hands for everybody who understands what a STP actually stands for or does? Okay, a bit hesitant, okay. The Sustainability and Transformation Partnerships at the bottom are just about wrapping all health and social care services around a particular geographical footprint. And then those hands that were up, the LWABs are, the Local Workforce Action Boards. There's less of an understanding, okay. And then this really doesn't make much sense to you, so I'll go straight to, this is how the Local Workforce Action Boards are meant to operate. So they are to deal with the workforce implications of your services on the ground, of your needs on the ground, and in particular to look in the kind of 5 to 10 year term at what your workforce will need to be to produce the kind of staffing and the kind of service that you will need to wrap around your particular geographical footprint. So any STP is looking via its LWAB to develop the workforce around its current and future needs. We've decided that ReSPECT is one element of a wider end-of-life care improvement project across all of Kent, Surrey, Sussex, and that ReSPECT should be implemented both community and acute at the same time if we can achieve it. So what Health Education England has done is it's placed some resource within a Hospice Education Collaborative for the early part of ReSPECT education and training. So our GPs, our community teams can come to their local hospice and say, we are hoping to align across the ReSPECT implementation group for that particular STP. And once the decision about going live has been decided per STP, the hospices will provide the community education and training around ReSPECT. Okay, so, this is the final 2 parts of what the LWABs do. And the LWABs, remember now, are not just a Health Education England support for the STP. All education and training budgets, it may surprise you that there would be pots of money in NHS England, because a service redesign can sometimes require some education and training. There would have been a pot of money for X type of service development in NHS improvement, targeted at some of these trusts that were struggling with CQC. There might be some money in public health. There might be some money in Health Education England. Essentially, the STPs offer us a way forward to rationalise some of the resource around particular pathways. And we're very hopeful that in Health Education England, Kent, Surrey, Sussex, we provide access to resources for teams to implement ReSPECT on a geography basis. I'll be describing my successes and failures in the next 5 minutes. So the Workforce Transformation Plan and the leadership and support to allow patients and their carers to confidently make decisions and competently lead change across pathways. And ReSPECT is one of the changes that we're implementing. This very busy slide describes an end-of-life care improvement pilot that we are testing currently in one footprint in one STP. That is Crawley, Horsham, Mid Sussex, East Surrey. Sorry, that's it. That's our initial footprint to scale up at the end of the year to the wider STP, and if successful, our solutions are acceptable to the other STPs, that they would be encouraged also to adopt our solutions. The ReSPECT process is only one element of this wider improvement work that we're trialling in this area. I'll give you an example of one of the strands of work we're doing. We are currently who provide 24-hour care for people in their homes, in care homes, because as you know, if we do things right with end-of-life care, we could potentially save a lot of money, but more importantly, we provide a much better service for patients and their carers, because the majority of patients want to remain where they feel comfortable. And so one of the strands of improvement is looking at broadening the spectrum of competencies within that 24-hour team that supports people in the community. These communities of practice or primary care hubs, the nomenclature is different wherever you go, and in different STPs it's called something different. But basically it's your out of hours, people thought of it as your out of hours team, but it's not. It's a whole 24-hour service in the community that currently is a multidisciplinary team that includes mental health and social work. We're considering broadening that to include specialist palliative care provided by our hospice sector, all the way across the spectrum to also involving volunteers, because very often we find that some of the needs of patients are just for somebody who'll give them a break or some respite or somebody who'll walk the dog. So the whole spectrum, from the very most specialist palliative care, complicated presentations, all the way down to befriending or volunteering, we are amplifying that's one of the strands of the improvement work. Now, ReSPECT fits into this because we believe that we shouldn't just implement ReSPECT if we have an opportunity to also deliver other education improvements. And so what we did was, in Surrey Heartlands, we had no difficulty getting the ReSPECT, well, Yanni would say differently, but in terms of resourcing the plan that Yanni put together, the business case that Yanni put together, there was no real difficulty getting the resource, because Surrey Heartlands is the most mature of the 3 STPs on my patch. It is so mature that this week it's just been officially approved, and the documents are being signed for it to become a devolved entity. And that's like Greater Manchester. So that's as a result of assuring the Department of Health that it was that far advanced, it attracted tens of millions of pounds in transformation funding that the other STPs didn't attract. And therefore the ReSPECT implementation for Surrey Heartlands got some transformation funding for the implementation. So this is one little tiny aspect of the business plan that Yanni put together for the Surrey Heartlands STP. She's very kindly shared it widely in Kent, Surrey, Sussex, and I'm sure that if you were nice enough and approached her and asked for permission, she'd share the full business case with you as well. But critically, one of the things we felt very strongly about was that the implementation of ReSPECT must attract dedicated staff and project support. It should not fall on just anybody else adding an extra responsibility to the day job, because that's what's happening, and that's what's happened, and that's what's bedeviled healthcare innovation on the ground in the NHS. Frequently, the one champion or the one enthusiast takes on too much, possibly burns out, and then where are we? So we felt very strongly that we wanted a full implementation package with project support, because we don't want just the acute trusts in patches to be the implementers. We want the entire pathway to be the implementer of ReSPECT, including community. So that's an example of a business case, and I want to really thank from the bottom of my heart Caroline Sterling from London, who almost a year and a half ago, nearly 2 years ago now, shared some of the projected savings for her particular part of London that allowed us to actually collect data on the ground for our CCGs on particular improvement projects. So as I said, one of the things, thank you very much Caroline, she's there. I didn't see you. I'm so pleased that you're here. This has given us a real boost, because we were able to go to our STPs and we were able to make the business case where we implemented in East Surrey an advanced care plan in care homes improvement project within 6 months. Conveyance to emergency departments were down 50% and non-elective admissions were down 38%. So based on Caroline's projected savings, we were able to put actual data against savings in one of our footprint. And on that basis, we presented to the STP slides that you will have sent to you from this today. And please, I've been tweeting from the conference today, please follow me on Twitter and ask me direct questions about this business case if you will. But we were able to show that with the trends in decrease admission, we could save enough money. And with these, the death in hospital trends are on the way down as well. But that the whole issue around increasing discharges or speeding up discharges or stopping inappropriate admissions was going to give us sufficient savings for us to attract the kind of attention that STPs are about at the moment, because they're all about savings. You really have to make the case that something you do is going to give you savings. Those are the ones for Kent, Surrey, Sussex, and we were unsuccessful in delivering this business case to the Sussex and East Surrey LWAB. And there was a very good reason we were unsuccessful, there wasn't enough money. By clearly placing our end-of-life care work within the urgent and emergency care programme, and also within the frailty context, and those are the two areas that STPs are really paying attention to. We were approached immediately afterwards and asked if our ReSPECT implementation could be a pilot for the summary care records programme that is very well resourced and that overarches all of Kent, Surrey, Sussex. So there's a programme of activity that each of the 3 STPs has contributed to, which attempts to rationalise the 40 organisations across those 3 STPs and their summary care records. Now, with the writable PDF for ReSPECT that it could be scanned and uploaded, we found that they will resource our ReSPECT implementation. And so my question at the moment is, and I'll be running away shortly, but I'd love if you'd give me some feedback, whether if I have this one opportunity for resource for ReSPECT implementation, I now just join Sussex and East Surrey STP, Kent and Medway STP, and have one team doing the implementation of ReSPECT across that much larger patch. Admittedly, each of the areas within those patches are at different stages of development, but the groundwork has been laid, and there's some great work being done, especially in Sussex and East Surrey, and I can see Steve Bass in the audience and Lauren from Sussex Partnership and Brighton and Sussex, BSUH in our patch. There's some great work being done on the ground. Sussex and East Surrey are ready to go. Kent and Medway less so. But I'm now faced with the question, since I have the one opportunity to get some resource against this ReSPECT implementation, do I just go for broke? Anyway.
Thank you.
That's it.